Thanks, James. Wow, that was a lot of detail around all of the different needs that are out there. And when you look at that, you really need to look at the telehealth systems with streamlined workflows to touch all of those different organizations. So with that growth, change, and the need to scale, what are some of the important things to prepare for in the months to come? The number one thing has to be considered workflow or streamlined workflow for all involved. The workflows within a telehealth system should be designed in such a way that simply providing the telehealth visit should support the necessary events for claims generations and processes. So, as we look at all of these different events in the slide that James just presented, it's really important that we're integrating these into our workflows and that they're just going to naturally flow. And as people are added or removed, we know the certifications and the level of those individuals, so that at the end of the day, because of the transition in healthcare going to so much telehealth, we need the ability to build these claims. So these next few slides are going to be focused on the ability to take on all of these changes and growth and the need to scale, and applying them to making sure you have processes in place that will allow you to do good claims generation and that entire AR process. So things to consider are medical necessity and medical need. Proof that the event actually happened, and that proof should be system timestamps that are not manipulated by individuals. Level of service provided. Do you know the certifications of the individuals performing the visit, so that you know that this is a service provided by a PT or OT or ST or a physician or an EMS provider in a mock scenario? The length of the event, so that we can support the variations of CPT codes and HIPAA codes, and of course, the place of service in that overall structure. Important events after the actual telehealth visit. Everyone's so focused on actually doing the telehealth visit, right? And it's important to consider the workflows after the telehealth visit. And I always call this the fraud and abuse, guardrails. What QA and QI processes do you have in place? And do they reflect the CMS roadmap items? Excluding redundant actions and support the source of truth. Are you entering the data more than once and then entering it again and again? And is the source of truth lost within all of these different systems that we're using to support that process flow or that workflow? Having work queues and filters with the ability to mark events as ready to bill. So in your QA process, do you have the ability to review events prior to passing them on to your billing solutions? And then the ability to mark events as exported, so that you know that, hey, I did my QA, I've got this event done, and now I sent it to my revenue cycle management solution, and I won't do it again accidentally, and again, and again in that process flow. And then being able to pull up, build events to support the claim, as it's just a matter of time before OIG knocks on the door to audit these records. I mean, with this tremendous hockey stick growth, when we grew 11,000% plus in 3 months, it is only a matter of time before it's going to get a strong eye from OIG and making sure that we have all of the workflows and processes in place to make sure we can support that. And that includes the ability to get this information into the electronic health record. So the solutions that we're utilizing need to also be able to push it into the EHR for its final resting place. So with all these changes happening so quickly, and everyone's looking into the crystal ball and trying to predict the unpredictable, it's important during these times that the telehealth platform, that it allows flexibility to adjust to those changes. So does the system have multiple secure ways to communicate in both asynchronous and synchronous way, like video and group video And the ability to, like in a group video, to add people, like James was mentioning, adding people to the team, like a language translator, in rural areas or in areas where they don't speak English or English speaking. Can you add translators into the process and to manage that information? Is it secure messaging with and without templates? Do you have the ability to asynchronously message people, and can you do that with templates? Can you do an audio clip where you can record and forward and get that information to the necessary teams? And then, of course, documenting templates so that you can add consistency to the ease of the QA process. If every event is different, then every event is different. And that's very difficult to provide good quality systems. So having structures to support all of this is really important in the overall workflows in a good telehealth system. Can you easily bring on team members? Like I mentioned, a good example is a language translator. Can you do it during group video? So if the person is deaf, that they can read sign language. Those are important components. And if you have the ability to easily know who's available on a team, bring on those translation services, that would be a really nice service within that telehealth system. Do the workflows support simply adding others to the event? And at the same time, it's important to know what the certifications of those other people are that are being added to the event, because they can affect the billing rate that you can bill for that event. So, those kind of are the pieces of the puzzle that we have to make sure that to be really efficient and compliant, that we have that capability. Does the system also have flexibility to update things to support the need for the medical need side of the equation? You can't just do an event because you can do an event, right? You can't just have a telehealth call because you can. There's got to be a medical need component to that. Why are you doing it? And you need to support that with the procedures that you performed, the medications that you provided, in your notes, etc. And all of that information will help support the medical needs side. So jumping ahead into the telehealth guidelines, as it relates to HIPAA, James had mentioned it's really important that as we're looking forward, that even though HHS waived the requirements to several of the HIPAA guidelines, it's really important that we all realize that those are coming back. When they in March 15th, they had a waiver, a HIPAA waiver, that allowed the ability to not require a patient's agreement to speak with family members and friends about the care, the requirement to honor a request to opt out, the requirement to distribute a notice of privacy in practice, the patient's right to request privacy restrictions, and the patient's right to request confidential communication. All of that was waived during the pandemic, and rightfully so, because we had a lot of adjustments to make. But it's clear that all of those requirements are going to make their way back, and any organization or any telehealth solution that you're looking to for the future needs to meet those requirements. So some HIPAA guidelines post-pandemic is, and considerations post-pandemic are: expect the Office of Civil Rights to not extend the waiver. And so when evaluating the software solutions, make sure that they're built for healthcare. As we all learned over many years, that people that have focused on healthcare, HIPAA-compliant healthcare solutions, are really good at what they do, and they understand the reasons behind what they're doing. And it's not just telehealth. It's not just launching a way for two people to see each other. They're doing it in a HIPAA-compliant way that keeps it HIPAA-compliant through all the workflows. The organization must sign a BAA. The organization must or should have advanced security certificates. They should enable end-to-end encryption and avoid storing any local data. And of course, comply with the security rule in respect to allowing authorized users to access the EPHI. So not only during the event, but post-event, who has access to this information. So with that, James, I'm going to pass the baton back to you.